If you got that low back pain that's on the sides, today I'm gonna go through the most common muscle that is causing the pain, what you can do to stretch it out, and what you can do to even strengthen it. I'm Dr. Matthew Posa. Welcome to my page. My page is dedicated to people and families with health tips and tricks so you can live the life you were designed to live. So don't forget to like, subscribe, and share this information with the people we know need it the most. There's a lot of people who have back pain, and a lot of the times the back pain is on the sides of the low back. So there is a muscle that attaches to the low back here to some of the ribs, but it travels on a downwards angle to the hip. So a lot of people can get it in the bottom of the ribs, you can get it in the low back, but oftentimes they're gonna say that it radiates down into the top of the hip. So if this is you, then the muscle that we're talking about is the QL, or the Quadratus lumborum. And this muscle is a stabilizer muscle, really good for holding your posture. It's really good for twisting and helping you do various activities. But what happens through lifestyle choices, if you sit down a ton, if you hurt it in picking something up, over rotating, if you have conditions like scoliosis, I mean, there's a lot of different reasons why somebody would have a QL issue. But today I'm just gonna go through some simple things you could do at home that's gonna get you some relief, and also you can build up some strength in some of the muscles that aren't working as much to take pressure off of the QL. Because the muscle runs on either side of your spine, you're gonna start by just laying down. So this is a really easy stretch, no matter how old you are. All you wanna do is, you're gonna do this on your bed, you can do this on the floor. But all you wanna do is, you wanna sit down, and if I wanna stretch my right QL, so my right side, I'm gonna take my left foot, I'm gonna bend my left foot, and I'm gonna place my right foot or my right leg on top. That's gonna give me a lever. What I'm gonna do is I'm gonna be bending my torso to the left, but I'm gonna take my right arm and I'm gonna be bending it up and over. So it's like a sideways, so you gotta make sure you're going to the side, but as you go to the side, then you're gonna reach out just a little bit in front. And as soon as you do that, you will feel the stretch in the muscle, because again, the muscle doesn't run up and down, it's actually angular, so it's a bit on the side. And this will allow you to really target that muscle in the low back. And I like to even push my torso out a little bit to the right as I'm pulling or I'm pushing down with my elbow on the left. I'm reaching out this way and I'm just holding that for that 20 to 30 seconds. And that's gonna get you a relief. This is my favorite stretch to do for the QL. So as you're standing up, all you're gonna need is the entrance to a doorway. And so if I'm gonna be stretching now my left QL, and the way to do this is you're gonna hold on to the side, and what you wanna do is you don't necessarily wanna hold directly in front of you. This will stretch your QL by leaning back, but if you slightly go up, so let's call it at head level, and what you wanna do is you wanna sit back with your bum, you wanna let go of the low back, so just you're holding on only with your hand, and then I'm gonna turn my torso to the left. So I'm gonna turn slightly to the left and I'm sitting back. Now, as I do this, you're gonna feel a deep stretch, especially if you got that low back pain. It's been there for some time. And then what you're gonna do here is you're gonna take a deep breath in and you're gonna breathe all the way out and out. And you're just holding that for 30 seconds. Now, the key with that one is the breath. And the reason why you wanna do the breath is because your QL attaches to the base of your ribs at the low back here. So it attaches there, and that has some implications also with your rib cage, so how you're breathing. If you got scoliosis, you got problems in the middle of your spine, your ribs are off, anything like that, that could be the reason why that's happening. So make sure you're getting yourself checked by a chiropractor. But in the meantime, you could do these stretches and you'll notice that as you breathe in and out, it actually will help relax the muscle. So make sure that you're using breath as you're doing that. Now we're gonna switch gears. Now we're gonna try one exercise that's gonna strengthen, not the QL, but it's gonna take pressure off of it. and it's gonna be your glute. So we're gonna do a glute bridge. So we're gonna be strengthening the glutes because it is a stabilizer muscle. It's gonna help with your posture, and it's gonna help take pressure off the QL, or the Quadratus lumborum. So what you're gonna do is lay on your back. You're gonna place both your feet firmly against the floor. Your shoulders wanna be back, your head is back, and all you're gonna do for this exercise is you're gonna strengthen the glutes. So you're gonna be squeezing your bum, lifting, so you're gonna be using some of your hamstrings. You're gonna lift your pelvis up to the ceiling, so you're making a bridge. You're on your shoulders, on the back of your neck. You're holding, you're squeezing your bum. You're only gonna hold this for 2 seconds at the top, and then you're gonna bring it back down. As soon as it touches, you're back up. So that would be 1, and here we go. We're gonna go 2. So we're just gonna keep going, and you're gonna do 12 of these. Now, as you do 12 of these, you're gonna notice your bum, you're gonna be squeezing your bum, so your bum's gonna get nice and tight, and this is gonna take pressure off the low back. It's gonna help stabilize a lot more of the low back, especially if you got anything with discs or you got other type of low back issues. This is really, really good to help build that up, and you're gonna get a lot of relief by making your glutes stronger. With that exercise, you're gonna make sure that you're doing 12 of those, so 12 repetitions, and we're gonna repeat that 3 times. And I would do that daily until you really start to notice the results. So those are my favorite things to do with the QL. You can see that it's quite easy to stretch, but more importantly, it is tied to a lot of other reasons for being off, for being overused, whether it's sitting all the time, again, at your desk, if you got poor posture, if you got other spine-related issues such as scoliosis, and then a wide variety of other issues from accidents and falls and sport injuries and so on. So try that stretch. Again, you're gonna do those stretches every single day. I like doing the stand-up one, but you can do the lay-down one if that helps you. And more importantly, make sure that you're strengthening the glute to take the pressure off, adding breath into that, making sure that you're taking deep breaths while you're stretching your QL is gonna be beneficial in helping the muscle relax even more. And if you are struggling and if you need help, make sure you go see a chiropractor. One of the best at analyzing the spine, making sure that the muscles are well balanced, making sure that conditions such as scoliosis or problems in the low back are resolved in order for you to get the results that you're looking for. If you like this video, don't forget to subscribe to my page. It helps me out a lot. And if you have questions down below, ask. I'm here for you, and I want to make sure that if you do have a question, that it gets answered. Until next time, we'll talk to you soon.